it's Khaki. I want to talk to you today about something that I get questioned about a lot, both by my patients and in the bariatric surgery community: loose skin after weight loss surgery. So let's talk about it. Why does it happen? Well, first off, as we gain weight, obviously our skin stretches to accommodate it. The loose skin is not caused by the weight loss, it's revealed by the weight loss. So, what are some things that we can do as we lose weight to help with this? Number one, people ask all the time, is my skin going to tighten up on its own? That depends on a lot of things. It depends on your age, it depends on your natural elasticity of your skin, it depends on the rate in which you lose weight, and some of it's genetics as well. There are some things you can do something about, but honestly, primarily, if you're going to have loose skin, you're going to have loose skin. There's not a whole lot we can do to prevent it. People will ask me, if I lose weight slower, is that going to prevent that loose skin? Well, if you have had weight loss surgery, chances are you're going to lose weight rapidly in those early stages. If you could lose weight slowly on your own, you would have done it already. People do lose weight at different rates, but losing weight slowly does not within itself help prevent loose skin. Again, going back to the amount of weight you lose, your genetics, your age, your skin elasticity. Whether you lose 100 pounds in a year or in 6 months, those other factors are going to come into play. Does exercise help? Exercise is not going to take away loose skin. It's going to build muscle, which may plump up under the skin a little bit and kind of prevent the appearance of some of the loose skin. But where we tend to have loose skin, in the arms, in the abdomen, in the back, you really can't build enough muscle to compensate it. Exercise has wonderful health effects. So I don't want you to not exercise because it's not truly going to help with the loose skin. It's going to help with a lot of other things. But loose skin, no, not so much. If I get enough protein, is that going to help? Protein helps build muscle. Again, it gives you collagen that helps with skin elasticity. It's going to help a little bit, but again, it goes back to the amount of weight that you lose, your skin's elasticity, which a lot depends on your age and the genetics. So protein, obviously, get your protein in. It helps with building muscle. It helps with all the other things that we want. But with loose skin, not so much. Do creams, supplements, vitamins, pills help? No. They really won't. If I had $1 for every time that a patient has said, if I use this cream, or if I take biotin, or if I take this supplement, is it going to prevent me from getting loose skin? All that's going to do is make for expensive urine and hit your wallet. It's probably not going to help with this. The last thing, when should I consider plastic surgery? As if you've been watching this channel for a while, you're going to know I had plastic surgery for skin removal. I've had 2 rounds. My first round, I had an arm lift, as you can see, with a tummy tuck. My second round, I had a breast lift and a torsoplasty, which is a circumferential body lift to remove mostly the loose skin on my back. I would recommend, when you have hit a stable weight and you've maintained it for several months, when you are at a weight that you and your team are happy with, And then when the loose skin starts to become a problem for you, if it's affecting the way your clothes fit, if you're getting rashes or infections under those skin folds, when all those things are met, that's when I would consider plastics. People ask me all the time, is my insurance going to cover this? Yes and no, and it depends. Insurance typically, if it covers skin removal, mine did not, but if it does cover skin removal, is only going to cover what is deemed medically necessary, not cosmetic. So if you've lost 100 pounds and you have an apron of loose skin on your belly and you are getting rashes under that are well documented, the removal of the loose skin would probably, if your plastic surgeon will fight for you, might be covered, but it's only going to cover that loose skin that's causing the problem. Most of the time, it's not going to cover tightening of the abdominal muscles, which goes along with the tummy tuck. Some surgeons will let you pay for that part of it and insurance pay for the other. So it's worth checking with your insurance. It's worth seeing. Arm lift, I have never had a patient be able to get one covered. My plastic surgeon said he had never had a patient be able to get one covered. So outside of abdominal skin, typically not. Although a breast lift or a breast reduction is sometimes covered. So those two surgeries, maybe. How do you pay for it? Well, number one, I think you need to find out how much it's going to cost. When you get close to a stable weight and you meet those other qualifications, go get some consults. Get a realistic idea of how much you're looking at. And then start saving. That's really the only way to do it. That's what I did. Find out if insurance is an option. If it's not, I think that sometimes people think it's going to be a lot more expensive than it is. Don't get me wrong, it is pricey, but sometimes you might be pleasantly surprised. So I get the question often, if I was not able to have my skin removed, my excess skin removed, would I have still had weight loss surgery? The answer is 100% unequivocally yes. The health benefits and the improvement in my overall wellness due to my weight loss far, far outweighs the problems that I had with loose skin. Fortunately, I was able to have it removed. It was not something I thought I was going to do. When I went into this, I didn't plan on doing it. I remember my sister asking me, are you going to end up having one of those skin removal surgeries like you see on my 600-pound life? I said, no, I'm not doing that. Once I get to the other end of this, I'm done. That wasn't the case, but even without that, I would have done this 100 times over. So, guys, I'd love to hear, where are you at in the process? Are you considering skin removal surgery? Have you had skin removal surgery? How did it go? Any questions that you have? Would love to hear video suggestions. This is something I get asked about frequently, so that's why I did this video. I've also done some other videos on this topic, so you might want to go back and watch those as well. I hope everybody has a great week, and I will see you soon. Bye.